Hi, I'm Lara Smith, host of the Sweaty Pillow podcast. I'm introducing our second episode, part 2, with Dr. Michael Breus, the world famous sleep doctor. We filmed a podcast that was so rich in very important life-saving nuggets that we're splitting it into 2 so that we honor our principle of not extending 40 minutes per podcast. So please, let's dive into part 2.
Now, when it comes to things like temperature, we know that temperature is one of the more important aspects of this because temperature gets very dysregulated while we're in the middle of all this kind of stuff. And so when we look at just health and sleep across early menopause, menopause, and then post-menopause, it's messed up, right? And sleep is usually one of the first things that's kind of the signal that's like, hey, by the way, this is banging on the door and you need to start to understand this, because women will have either disrupted sleep where they're waking up for no reason, not necessarily for a hot flash, although that can occur, but then coincidentally or cumulatively, that ends up happening. Now, to be fair, hot flashes do not happen in every single woman. We get that, we understand that, but there are differences in these hormonal variations which cause physical issues that are sleep related. So we really see women falling into 2 different camps when it comes to sleep and the menopause journey, let's say as pre-menopause and then post, right? And so first of all, it starts out with a lower quality of sleep. So women start waking up saying, gosh, I usually sleep great, Michael, and I just don't feel like my sleep is as deep. I don't feel like I'm getting as much out of my sleep. And by the way, I've been waking up a lot. And now sometimes these awakenings are to use the restroom, but more times than not, they're not. It's just a restlessness and uncomfortableness. Also, as women start to get into this age range is where we see something called restless legs syndrome can become quite prevalent. Right. Yep. And that is a sleep disorder that can be addressed and actually can be there's quite a bit of data to show that there are protocols that can be quite helpful with this. By the way, if you are experiencing restless legs, and let's just give everybody a quick primer on what is restless legs. So restless legs is kind of this creepy, crawly feeling that only seems to happen when you lie down or sit down for an extended period of time, like 20, 30 minutes. But it's like a tingly, it's like bugs crawling across your legs type of thing. And it's under your skin. And the only way it's relieved is to stand up and walk around. Now, that's all well and good during the daytime. But when it's midnight and you're getting this feeling, you can't be walking around your house all night long because you ain't sleeping, right? And so number one thing that we ask women to do in particular is have their iron checked. Now, a lot of women have anemia anyway, but this is a different form of iron, something called ferritin, Ferritin, ferritin. It's a type of iron. By the way, when you go to get your blood work done, you have to ask for a ferritin specific blood test. It doesn't just come in your regular old iron test. And here's what we discovered is while the levels of ferritin can be 10 to 300, anything below 60 seems to cause this restless leggy kind of feeling. So you could have normal ferritin, but if it's below 60, this could be a symptom that you're experiencing. And again, this is something that we see a lot of people as they get older, men and women, but it does appear to be a bit more prevalent in women because of their general anemia beforehand. And it's something that they should be understanding. Now, here's the good news is all you have to do is take an iron supplement and you can get rid of a lot of these types of symptoms. A generic iron sulfate, you can buy it at Walgreens for like $4. 300 milligrams twice a day can work miracles. Be clear, when you take iron, you got to worry about constipation, right? It kind of pulls the water out of your system. So number one, you got to make sure you're hydrating. That's a must, which by the way, a lot of people aren't so great at as they get older. They don't really think about hydration. Sleep requires a hydrated body. In order for you to get to the depth that you want, you've got to be hydrated. Now, people always wonder, like, how do I know if I'm hydrated, Michael? when you pee, if it's clear, you're hydrated.
Mm-hmm.
If it's not, you ain't hydrated. The darker your urine is, we need to make a qualification here. There are some supplements that will make your pee look like bright orange yellow and all these other things. I'm not talking about that. I'm just talking about regular old normal urine, not influenced by vitamins or minerals. It should be a light yellow to almost clear. The darker it is, that means the more concentrated it is, which means the less water you have in your body, which means water affects your ability to fall asleep and get into the deeper stages of sleep. So when we talk about restless legs, that is an important factor of something that can happen, especially as we get older. Second sleep disorder that can happen that can change the depth of sleep, especially for women, is sleep apnea. Now, a lot of people are like, Michael, come on, like sleep apnea, that's a big person's disease. No, that is absolutely positively not true. What we have now learned is once women reach menopausal age range, the ratio changes. So historically, it's 2 men for every single woman that gets diagnosed with sleep apnea. That ratio goes to 1 to 1 as soon as women hit menopause. Yep, absolutely. So it's something to be thoughtful about here, is to say to himself, okay, well, could I have any of the signs or symptoms of sleep apnea? So let's talk about what some of those are. So the signs and symptoms of sleep apnea are snoring, are waking up gasping for breath, waking up with a headache in the morning, having moods that go up and down, restlessness during the night, having to pee during the night. All of those can be signs and symptoms of sleep apnea. But by the way, those can all be signs and symptoms of menopause too. It can be difficult to tease them apart. So one of the things that actually is good that happened from COVID was that during COVID, we had sleep studies that we would put people in the laboratory. Well, once COVID hit, nobody wanted to go to the laboratory where somebody else had been sleeping. And so the technology advanced quite rapidly. And now we have these things called home sleep tests. So home sleep tests are really cool. And we offer them at Sleep Doctor. So we'll give you the link for that if you have an interest in it.
Yep.
And here's the best part is you get a better environment, right? And so you actually do these tests in your home versus going to a lab and having 27 electrodes put on you and respiratory belts across your chest and a camera looking at you in a weird place. Like, who the hell sleeps well there? Nobody, right? But in your home, we get much more accurate. And here, I'll show you one of the devices because I have one here by my desk. Like, this is it. This is the whole thing.
Okay.
You put this on your wrist, put this on your finger. It's like this. You push a button and you go to bed. You wake up and you push a button and the information goes through Bluetooth or whatever to your phone. Then this goes to the cloud. And then we have doctors who are board certified in all 50 states who will read your results and then explain to you, hey, you got sleep apnea, here are the treatment modalities. Hey, you don't have sleep apnea, good for you. Like, let's move on to some other symptomatology. So the good news here is, and oh, by the way, the whole thing's less than $200.
Incredible innovation. Yeah.
And you can actually use your HSA account for it now. So very practical for a lot of people. So, you want to think through, as I'm getting older, I'm female, what's going on? It's not just about, early menopause, post-menopause any longer. It's also kind of understanding some sleep disorders and what could be doing that. But let's say, for argument's sake, you don't have a sleep disorder, which would be great, right? Now, what are we looking at? What are some of the changes to my sleep as I'm moving through this journey or this transition? Well, there's quite a few. So one of the things we know is that as your estrogen and progesterone go down, the depth of your sleep is no longer there. You end up in light, crappy sleep, which is one of the reasons why women say, I'm so restless, I get up in the middle of the night. Also, they ask about having to go to the bathroom. My theory on having to go to the bathroom is you're in a lighter stage of sleep during this period of time, and so you feel your bladder more. If you were in a deeper stage of sleep, you would sleep basically through the night. So we do see a lot of insomnia that occurs secondary to menopausal symptomatology, and that's definitely something that we would want to address, right? So, okay, Michael, how do you address that? Well, number one, we do blood work, right? Let's see what your iron looks like. Let's make sure that you don't have iron poor blood or that you've got low ferritin or something like that. While we're looking at that, we look at magnesium, we look at vitamin D, because those are two things that most people are deficient in. And it may make sense for you to get them through some level of supplementation. So we kind of look through that. So blood work is always key. Looking at those three things in particular are my favorites. Next, we do a sleep study. Make sure you don't have sleep apnea or some other sleep disorder. Okay, everything kind of from there kind of looks good. Now we look at temperature regulation, we look at hormone replacement therapy, and we make sure that your schedule is one that is good for your chronotype, right? So if you know your chronotype, then you lock into that schedule where your body wants to naturally sleep anyway. And then we start to look at some of the external factors, right? Like caffeine and alcohol and stress, right? And so let's double tap a little bit on caffeine, alcohol, and stress, just for completeness, so the audience can understand. So caffeine basically really kind of messes up REM sleep, right? And remember, REM sleep is your mental restoration. So this is the stage of sleep where you move information from your short-term memory to your long-term memory, which is quite fascinating and can be quite helpful. But we need that sleep, right? But caffeine, it's not a friend of REM sleep by any stretch of the imagination. Now, the other big thing that a lot of people don't realize is some people are caffeine sensitive and some people are not. So this is going to sound like a crazy story. So I have a concierge doctor, Dr. Carrie Bordinko. She takes care of me, and she drinks an espresso every night right before bed. Right? And I'm like, Carrie, I'm the freaking sleep doctor. Like, you can't do this. And she's like, Michael, caffeine doesn't affect me. And I'm like, caffeine affects everyone. What are you talking about? And so we ran blood work, and it turns out she does not produce the particular enzyme that digests caffeine. So it literally flows right through her and she pees it out. So she really can have espresso before bed. I want to be clear, there's not a lot of Carrie Bordinkos out there. But we have to think through this as an idea, and this kind of highlights the idea of caffeine sensitivity. Now, one thing I will tell you is as you get older, you get more and more immune to the subtle effects of caffeine. You're used to drinking coffee. Your body's used to it. And for a lot of people, it's a habit, right? It's like, I have a cup of coffee in the morning. I have one with lunch. Maybe I have one after dinner type of thing. And it's more habitual than anything else. And so we really want to be thoughtful about this because, again, we don't want to do your sleep's already not going to be so great because you're going through menopause. The last thing we want to do is put extra hurdles in front of you while you're trying to get through this. The second biggie is alcohol. Now, I'm going to be honest with you. Alcohol is a tough one. More people drink themselves to sleep than any other sleep aid in the world. It's kind of crazy, and it destroys your deep sleep. Right? Now, deep sleep, for folks to remember, this is your physical restoration. This is kind of like bringing the car into the body shop and getting the scratches and the dinks and the dents kind of pulled out every single night. Also, there's a very important process that goes on during deep sleep called the glymphatic system. So the glymphatic system is kind of like the dump truck of the brain. It comes in and it scoops out all of these proteins that have a tendency to build up in your brain each day. Now, you might be saying, proteins in my brain? Like, what are you talking about, Michael? So whenever you think and you make decisions, that electrical current that zips across actually creates some substance. And this substance eventually is a protein. There are two proteins in particular that are quite interesting. One is called beta amyloid. The other is called tau. If these are left in your brain and they accumulate, they like to wrap around the nerves. That's called Alzheimer's disease. Do I have everybody's attention now? I hope.
Yeah, I just sat up straight. Yeah.
Yeah. So if you don't have a properly functioning glymphatic system, the proteins stay in your brain, and over the course of time, you are banging on the door for Alzheimer's. And alcohol close to bedtime turns that system off.
Sweet mother of God. Like, this is a 911 life-saving type stuff here, because I'm tracking our conversation, all the things you're saying that are immediate tools, immediate testing, immediate things that we can go do differently, the iron, the hydration, the chronotypes. And now you're saying alcohol before bed is the worst possible thing you can do.
Bad idea. Now, but I want to be clear. I like bourbon. I do. It's just
Same. It's like
right.
a
I like bourbon. I can't help it.
relaxing.
Right. Yeah,
Yeah.
it's relaxing. So I figured out a way to do this so that you can do
Okay.
this and still have your lymphatic system in reasonable shape. So what you want to do is be a day drinker. No, I'm just kidding. What you want to
I
do
was
is drink
worried. Yeah.
earlier rather than later, and you want to limit the amount. Okay. So
Okay.
as an example, let's say you're starting dinner at 7 o'clock and you're going to bed at 11. Okay. Seems pretty reasonable for most people. So if you're starting dinner at 7, you have your glass of wine with your meal. Maybe halfway through, then you have a glass of water. You want to alternate wine,
Mm.
water, or spirit water. You want to add a little fluid to the system, because remember, alcohol is a diuretic, and once you break the seal and you start to pee, you're peeing all night long. So we want your body to be hydrated. So have your glass of wine, have a glass of water. Now you can have your second glass of wine, right, which you may or may not
Mhm.
finish, right? And then
Mhm.
your second glass of water. Now you're done. You give yourself 3 hours before lights out, because it takes the average human approximately 1 hour to digest one alcoholic beverage. So you've had 2.
Mm.
I want to give you a little extra room there. So it's glass of wine, glass of water. Now it's 7:30. Glass of wine, glass of water. Now it's 8 o'clock. Stop drinking. Go to bed at 11.
Mhm. Okay. There's
It works.
the formula right there to
Yeah.
save our brains. No one needs to worry about Alzheimer's with all the other stuff that we're worried about.
Isn't that the truth?
So I want to shift gears because a lot of your YouTube, a lot of research is talking about gut health,
Yeah.
metabolism as it's connected to sleep. So talk to us a bit more about that.
Yeah, so I wrote a book. My second book was called The Sleep Doctor's Diet: Lose Weight Through Better Sleep, where we talk about the relationship between digestion and sleep. So it turns out that the more sleep deprived you are, now let's define sleep deprivation for your audience. This could be not getting enough sleep, but it could also be getting poor quality sleep. Okay, those are two different types of sleep deprivation, and many people have both. So what
Mhm.
I try to explain to people is there's a lot of different things going on. So when you become sleep deprived, 4 things happen to your body. Number 1, when you're sleep deprived, your metabolism slows down. Now you might be saying, well, why
Oh,
does
yeah.
it do that? Well, when you're up longer than you should be, your body's trying to conserve the resources that you've got inside, the carbohydrates and the fats and the
Mhm.
protein, because it doesn't know how long you're going to be up, right? So it slows down your metabolism. The other thing it do is it increases your appetite. Why does it do that? Again, because you need more resources. So it kicks into gear.
Mm.
Hey, I need to go find something to eat, but I'm going to slow down the burn of the resources that I've got on board. So
Mhm.
already sleep deprivation is not your friend when it comes to a diet, right? Now it gets
Mhm.
even worse, because there's 2 hormones that get dramatically affected. One is called leptin, the other is called ghrelin. So ghrelin is the go hormone, starts with G, so that's how I remember it. And it increases hunger. By the way, appetite and hunger are 2 completely different things in your brain. And so now your hunger has kicked into gear by about an extra 20%. And leptin, which is the feeling of satiety or feeling full, that goes down by 15%.
Mhm.
So you've got increased appetite, increased hunger, you're not feeling full, and your metabolism is slower. Oh, but it gets even worse when you're sleep deprived. One last thing is you start craving high fat, high caloric food. Now you might be asking, well,
Yeah.
why do I do that? Well, because cortisol is now humming around your brain saying, why are you awake? What's going on? Is there an emergency? Right. And so the only way to quell the cortisol, right, is with serotonin. You know, the easiest way to have serotonin? Eat a Snickers.
Fries. Oh,
Yeah,
Snickers. Yeah.
absolutely.
Go to. Yeah. Mhm, mhm,
Yeah,
mhm.
just whatever, muffins, fries, like whatever your high
Yeah.
carbohydrate, high fat food is, that is the
Mhm.
go-to. So sleep deprivation has a dramatic effect on weight gain and weight loss. And so if people are out there and that, like, New Year's is kind of around the corner. And when people are thinking
Yeah.
about, hey, what's my New Year's resolution? Number 1 New Year's resolution is to lose weight. I got news for you. You ain't going to do it if you ain't sleeping. Like, it just doesn't work well, right?
Mhm,
Now,
mhm, mhm.
interestingly, we're in an interesting time nowadays because of these things called GLP-1s, right? So these are the
Yeah.
Manjaros and the Zepbounds and all of the medications that are, Wegovy, I think, is another one. These are all these medications that you can inject yourself with, and helps you lose weight. Now, I want to be super duper clear. When it's helping you lose weight, you are losing 50% muscle and 50% fat. Okay, so this is
Yeah.
not just concentrating on fat. you lose both at the same time, which can be problematic. Somebody came to me the other day and they said, are these GLP-1s, are these the new treatment for sleep apnea? Because remember, sleep apnea is a situation where there are people, probably 60% of them, where in fact, they have sleep apnea on top of their weight gain. And so when they lose weight, you start to see them actually get better with their sleep apnea. So here's what I'll tell you is GLP-1s have been around for 25 years. We've been using them in diabetes forever. We have never really been using them for weight loss in this way. Also, by the way, it seems to change cravings. So for example, if you're a gambler, it seems to slow that down. If you're a constant snacker, it seems to slow that down. And they're even looking at GLP-1s as a micro dose. So not giving somebody a full dose every day or every week, but to giving small doses along the way, which can be quite helpful. So when we look at all of the medicine that's going on in the weight loss arena these days, we also need to be thoughtful. How can this affect my sleep? Generally speaking, it appears to be positive. The timing of when you take your GLP-1s does not appear to affect your ability to fall asleep or stay asleep. The weight loss does seem to help with overall sleep from a whole bunch of different standpoints. But being able to get into deep sleep appears to be a bit easier with these medications as you lose weight. So I want people to be thoughtful. And, look, if you're on a CPAP machine or you're doing some form of treatment for sleep apnea, and by the way, there's a GLP-1 that's been cleared for sleep apnea, right? So as an indication, not for weight, but for apnea, it's called Zepbound. So you want to be thoughtful and consider some of these, because this could be a good part of your upcoming treatment protocol for your sleep apnea. And I'll be honest with you, I've had a couple patients where we take them off treatment because they've lost enough weight. Now, again, this is not the norm, okay? Not everybody who has sleep apnea is a big person, and not everybody who loses weight as a big person is going to get rid of their sleep apnea. But it definitely happens, and it definitely helps. The other aspect I think that's important to talk about is the microbiome, right? And so what is the microbiome? How does it work? Things like that. So what's interesting here from a sleep perspective is the microbiome has a circadian rhythm. No kidding. Yeah, it's crazy. So the microbiome is your gut, basically, with billions and billions of bacteria in it. And this is a whole system that is working in your favor most of the time. Now, if you're eating over-processed foods and things like that, it can hurt your microbiome. You want a healthy microbiome. How do you do that? Fermented foods seem to be something that is quite useful for microbiomes. Understanding your diet, hydration, all of these things are very valuable tools to have a healthy gut. Otherwise, you end up with something called leaky gut disease. Now, I want to be clear. The American Medical Association doesn't necessarily recognize leaky gut, or at least I haven't found that they have. But I do think there's something there. And I do think it's worthwhile to start to understand how you can be proactive with helping your gut health and how that can affect your sleep. I did a great video on my YouTube channel on probiotics and sleep. And I'm going to tell you now, and you're going to be surprised, but probiotics are not necessarily the best idea. And they definitely don't help with sleep. So what ends up happening is some of the probiotics are inappropriate for people. So that's where you want to get blood tests done, and you want to work with a doctor, probably a functional medicine doctor, because that's really the type of doctor that appears to have the knowledge base and been trained in this area more so than our traditional doctors are. And I think that is going to be worthwhile. Now, the question that I don't know the answer to, which is how does the microbiome affect menopause? I don't know the answer to that, but my guess is there's an effect somewhere in there.
Yeah, we've had a couple specialists that talk about the impact of gut health and just overall, just your production of your hormones. Yeah,
which is produced
being regular. That is a definite thing for women in midlife, just not being regular. So if you can improve that, but I think what I'm hearing is, and I didn't pay as much attention as I should have all this time of doing the sweaty pillow, is if women can focus on sleep health, the other symptoms, the other downstream medical concerns can be alleviated greatly.
100%. You are correct, my dear. That is absolutely right. And look, it's easy for me because I'm the sleep doctor. Like I'm always talking about sleep. I'm always trying to tell people, hey, sleep's the most important thing. Hey, you really should get better sleep. You know, I'm kind of like the cheerleader for sleep, but the research holds. Like
Yeah.
like every single thing you do better with a good night's sleep. Sleep affects every organ system and every disease state. Like if you are sleeping better, your body is better. And the opposite is also true. I want to be very, very clear. If your sleep is not good, something's wrong. Like I want to be
Right.
clear
Yeah.
about that. Like
Yeah.
some people are like, oh, I'm just stressed. I got 4 kids. I got a tough job. No, wrong. Okay. Many people handle all of that and sleep like a stone. If you are not sleeping well, if you are requiring a sleeping tablet or a PM medication, a Z-Quil, an Advil PM, a Tylenol PM on the regular, that ain't good. You need to talk with a sleep specialist to be able to learn, hey, what are some of the natural things that I can do that would be better off than taking NyQuil, right? Or Z-Quil or any of these PMs. By the way, the main ingredient in them is Benadryl, otherwise known as diphenhydramine. And there is now direct evidence that shows it leads to Alzheimer's. So I know.
Jeez.
So like, I just want people to get better sleep. And I don't think you need to have a pill to do it. I've been doing this for 26 years and I have yet to be forced to put anybody on a pill. However, I will tell you, there's no shame in having a sleeping pill if you and your doctor have come to that conclusion, right? So I've got patients who are paranoid schizophrenics. They get their sleeping pills. No question about it. I got people who have serious low back pain. They get their sleeping pills. No question about it, right? So there are situations where I think it makes sense. But generally speaking, I feel like too many people are on sleeping tablets. And I've been able to get most of my patients off of them using taper schedules and working with their doctors to get them sleeping better. And then we schedule them better. We know what their chronotype is. So we now know when they should go to sleep. We teach them some of the rules and guidelines for sleeping better. And generally speaking, they do much better.
Love that. So this is a podcast that every single person will need to hear because there's life-saving strategies. You kind of lay out the toolbox, if you will. But in summary, you've got a early to mid 40s woman. She's starting to see her sleep, either quality or disruptions.
Yeah.
What's the 1, 2, 3, 4, 5 prescription that she should go do?
Yep. So step number 1, figure out your chronotype. So you know when to sleep, and that can be helpful. So number 1 is figure out your chronotype. And then once you do that, as a response to the answer in the quiz, you'll get a string of emails which will teach you when to go to bed, specific to your chronotype. So whatever your sleep animal is. So that's number 1. Number 2, I would say, notice what's going on. Like keep a sleep diary for a week or so and just jot down, what time did you go to bed? What time did you wake up? How many times did you wake up throughout the night? What happened? Was it because you were hot? Was it because you were uncomfortable? Was it because you had to pee? Like, and then take that data and bring it to your doctor and say, hey, something is going on here. Because once again, most people should be able to sleep just fine, assuming that they're not, drinking espresso before bed like my doctor does, or having a gallon of Gallo wine before then either, right? That's not too good either. But if you're doing the right stuff and it doesn't seem to be working, I think that's a time. And then the first thing I do when I ask my patients to go to their doctor is do blood work, right? Look at your magnesium, look at your iron, look at your vitamin D. Let's see where those are. These are very straightforward, real tests that you can request and have done, and then be able to have actionable events to do. Step number 3 is consider a sleep test if you think you need it, if you and your doctor think that you need it. And if you feel like you're too warm or too cold, check out the Orion Sleep. I mean, I love this thing. I'm excited to be part of their company, and we're helping people all over the place. So it's kind of cool.
My God, this is really, we're going to get all the stuff for the show notes. We're going to add this detail to our community page with our favorite brands. And I can't thank you enough because I thought I knew a little bit about this space. After a year and a half of talking to experts, I learned so much. I'm gobsmacked and just, thankfully we have a recording, or I'd be pissed that I couldn't take notes because this was really shockingly informative and life-saving. So I can't thank you enough, Dr. Breus, for making time for us and our community today.